Hello everyone, welcome to BioTales. Today we are going to talk about valley fever. Valley fever is also known as Coccidioidomycosis. It is a lungs infection. It is also known as California fever, desert rheumatism, San Joaquin Valley fever. This disease is most common in United States, including certain parts of the southwestern United States, mostly in California and Arizona, Mexico, and parts of Central and South America. This is also a common cause of community-acquired pneumonia in the endemic areas of United States. Valley fever is caused by a fungus called Coccidioides. Two species of Coccidioides are called Coccidioides immitis or Coccidioides posadasii are mainly the causative agent of this disease. These fungi are usually found in the soils, and various agriculture practices like ploughing, farming, or wind or construction can spread these fungi spores into the air. The people breathe in these spores and then get infected with the virus that causes valley fever. The symptom of the valley fever depends upon the severity of the infection. It can either be initial or acute fever or a more serious type like chronic or disseminated infection. Now let's discuss that how these symptoms vary at these different stages. If the infection is acute or initial, then the symptom will not be severe. The incubation period is usually 1 to 3 weeks, means the symptoms appear after 1 to 3 weeks after a person or animal first exposed to the virus. The symptoms include chills, cough, fever, headache, fatigue, short breath, sweating at night, muscle aches, joint pains, red rashes at various parts of the body, mainly on legs, but possibly on chest or other parts. If a person gets infection, then due to acute infection, either he develops severe symptoms or doesn't develop any symptoms at all. If he has severe symptoms, then it means that it can take months to fully recover. And if he is also feeling fatigue or joint pain, then it can even take longer to get fully recovered. On the other hand, if he doesn't feel any type of signs and symptoms, then he will not be able to find out that he is infected and later can find it out in his lung x-ray in the form of nodules. There is nothing wrong with these nodules, but the only problem is that it looks like cancers on x-rays. If the infection is not completely treated, then it can progress toward a chronic infection in the form of pneumonia. It only happens in those people which has very weak immune system. In chronic infection, the symptoms are weight loss, chest pain, low-grade fever, nodules in lungs, blood-tinged sputum means the matter which is discharged during coughing. There is further progression of infection which is very uncommon but happen when the infection spread from lungs to other parts of the body. These parts may be liver, brain, heart, skin and other membrane which are involved in protection of spinal cord and brain. The signs and symptoms of the disseminated infection depends on the body part which is affected, like swollen and painful joints, especially of ankles and knees, painful lesions in spine and skull, nodules, ulcers, and skin lesions that are more serious than rash, meningitis, which is actually an infection of the membrane of brain and spinal cord. Now let's discuss the life cycle of this microorganism. In the soil, the fungus live as mold with a long thread called hyphae. These threads break into tiny spores called arthroponidia. They are very small, 2 to 4 micrometer, and can float in the air easily when the soil is disturbed, like during digging or windstorm. When people breathe in these spores, they enter into their lungs. Inside the lungs, the spores change into a new form called spherule. Spherule grows and fills up with endospore, means the tiny copies of the fungus. When the spherule bursts, it releases the endospore into nearby tissues. These endospores can turn into new spherules and keep the cycle going. So the fungus changes shape depending on where it is. Molds in the environment means in the soil, and spherule in the body means in the lungs. The shape-shifting ability helps it to survive in different environments. Now we see that how this valley fever can be diagnosed. There are several methods to diagnose valley fever. Number 1 is blood test. Blood sample is taken from a vein and sent to a lab to check for antigens. Antigens are the part of the fungus, or to check the antibodies, which is actually a body's response to these fungus. This helps to see if the person have an active or past infection. Second one is biopsy. A small piece of tissue is removed either from the lungs or skin or other affected area and examined under a microscope in the lab to look for signs of the Coccidioides fungus. Third one is chest X-ray or CT scan. Imagine testing like chest X-ray or CT scan are used to check for signs of valley fever pneumonia, such as lung inflammations or nodules. Fourth one is skin test. A small amount of valley fever protein is injected under the skin of the forearm. The area is checked after 48 hours. If there is a reaction like swelling, it means that the person has been exposed to the fungus, but the negative test doesn't necessarily means no infection. False negative tests are very common in the case of valley fever. Now let's discuss that is this fever is contagious. This is the disease of mammals. Human and pets can become infected. However, valley fever cannot spread from person to person or between people and animal. Now we see that how this disease can be treated. In case of mild fever or mild infection, many people face very mild symptoms like cough, fever, and tiredness. Those people often get better on their own and they don't need any treatment. But for moderate to serious cases, doctor may prescribe an oral antifungal medicine like fluconazole, and the treatment usually lasts 3 to 6 months. These treatments are mostly recommended for the people with more serious infection, weakened immune system, and other health risks. In the case of severe infection, if the infection is spread in the lungs or to the other body parts, hospitalization would be required. In such cases, the treatment may last longer than 6 months. If it spreads to the brain, means if it has caused the meningitis, then it can be life-threatening if it is not treated, and it would require lifelong antifungal medications. Now we discuss that how we can prevent valley fever. Currently, there is no vaccine available to protect against valley fever. If you live in or are visiting areas where the disease is common, especially during dry season after rainfall, it is important to take simple everyday precaution to lower your risk. Here are some useful tips. Wear a mask when you are in dusty areas, especially if you are doing outdoor work or in a place with disturbed soil. Avoid extremely dusty environments like construction zone if possible. Stay indoor during dust storms to avoid breathing in airborne fungal spores. If you need to work with soil, wet it first to prevent dust from rising. If you are at higher risk of infection, like you have weakened immune system, it is best to avoid digging altogether. Keep windows and doors shut tightly to keep dust from entering your home or car. If you get any cuts, wash them well with soap and water to reduce the risk of infection. That was all about valley fever. Thank you.